Hi, thank you for joining us today for this webinar on the state of your health, how new laws may impact you. My name is Kristen Crawford, State Director of Advocacy and Access for the Arthritis Foundation. The Arthritis Foundation Advocates have played a pivotal role in more than 100 state legislative victories across the country since 2014, including the new law on step therapy in Texas. But what do those victories mean for patients and their access to care? The Arthritis Foundation has you covered as your go-to resource to learn more about the benefits of these new and improved changes in law. We are here to help ensure that your new protections are implemented fully and that patients in your state know their rights. This includes providing resources like this webinar that explain the issue, the new law, and what it means to patients. The purpose of this video is to learn more about the step therapy law in Texas that was fully implemented in 2018 and what to do if you feel the law has been violated. First, let's define step therapy. It is a protocol or program that establishes the specific sequence in which prescription drugs that are used to treat a specific medical condition and are medically appropriate for the patient are covered by a health plan insurer. We had amazing champions in the Texas legislature on this step therapy bill. A huge thank you to Senator Kelly Hancock and Representative Greg Bonin for all of their help in passing this important legislation. Now that there is a step therapy law in Texas, we want to make sure you know what that means. If an insurer denies a request, they must provide a reason within 24 hours for urgent healthcare situations and 72 hours for non-emergencies. Medical exceptions shall be approved if any of the following take place. 1. The required drug is contraindicated, meaning the drug may be harmful to the patient. 2. If the required drug is expected to be ineffective. 3. If the treatment is not in the best interest of the patient based on medical necessity. 4. If the patient has tried and failed under current or previous insurance and the doctor submits evidence of failure or intolerance. And finally, if the patient is stable on prescription drugs selected by his or her healthcare provider. Who benefits from this new law? This law is not applicable to patients who have Medicare, Medicaid, or ERISA-protected self-insured plans. To learn if you are covered, contact your insurer and provide your policy number. What if your prescription is denied? If your medication is denied because of step therapy, your insurance won't cover the prescription. At this point, you may want to talk to your pharmacist and healthcare provider about alternatives that would be covered. You can also decide to pay out of pocket and compare discount cards, cash prices, and assistance programs to determine what works best for you. Here are the steps you should take to begin the appeals process. Ask your pharmacist what they heard from your insurance company and write it down. Call your doctor and report the problem. See if they can suggest next steps to get your medication. Call your insurance company and find out how to appeal the decision. Your physician often needs to intervene and write a letter. Share copies of any insurance letters or information you receive with your doctor. Make sure you stay on the same page. Here are some tips for working with your insurance company. Check with your Human Resources office to learn the specific rules to your plan. Check to see what measures your physician has already taken with the insurance company. If nothing has worked, you may need to appeal the insurance company's decision. Call your insurance company to find out why your medication did not receive approval. The number to call should be on your insurance card. Find out if your appeal needs to be online or if there is another process from your insurer. Keep notes of all conversations, who you speak with, dates and times of the calls, and case reference numbers. Having good records helps move future calls forward. Stay in touch with your doctor through the process and share information. Your insurance company must provide the reason for your denial in writing. Ask about it if you have not received anything. If submitting an appeal yourself, include all relevant documents that may help your case. This includes letters of support from your physician, test results, and your personal narrative. Here is the website and phone number for the Texas Department of Insurance. But remember, before you can request an external review, you must have completed the internal review process provided by your insurance company and received a final decision. If you have any questions or need additional information, all of our resources will be available on the Arthritis Foundation's advocacy webpage. If you have additional coverage questions, we encourage you to visit Your Coverage and Care through Prescription for Access. This go-to resource will help you better understand health coverage options, determine how your current plan meets your arthritis care needs, and it'll guide you through the claim denial process. The kit includes information, tips and tools for consumers to get the most coverage, and how to avoid or minimize claim denials. The kit includes step-by-step instructions, sample letters, and consumer assistance information to guide users through the appeal process. Additionally, the Arthritis Foundation's helpline provides people with arthritis, especially those most vulnerable, tailored solutions to inquiries about arthritis and its management. The phones are staffed by licensed clinical social workers who provide expert answers to questions about access to healthcare, information about resources to pay for medication, and community resources. Thank you for listening to today's webinar as we want to make sure that new state laws are being implemented fully so patients can enjoy their new protections.